ये exercises से आँखें ठीक हो सकती हैं?
Small numbers can be corrected, can be reversed. Say low myopia, which can be because of muscle spasm, can be reversed by eye exercises. Low hypermetropia need not be corrected because all of us, mostly people are born with the plus number. To the extent of almost +2 or so a child is born with, which becomes nearly okay by the time the child is about 5 to 7 years of age, becomes nearly 0 or so, or a little later.
Right.
So a small amount of plus number is normal in early childhood and need not be corrected. A high plus number or high asymmetry in the two eyes, which needs to be corrected. A low myopia of less than 1, especially if there is not much of a cylindrical number, need not be corrected. 1 or more, it needs to be corrected because then the child is not able to see very, very clearly far off things. So his child is losing out on the information that he's supposed to receive.
What can a child do as a self-care for their eyes?
Play, play, play as much as you can outdoors, out in the sun. Have fun in sun. So the mantra for the kid should be have fun in the sun.
That's a great one.
Yeah. For adults, I say run in sun. But for kids, I would say have fun in sun. So play around, jump around, go and play in mud, and be physically very, very active, be curious, and have a lot of outdoor time having fun, and that's important. And kids are supposed to have fun, and it is that fun also that makes the personality of the adult. So a child having fun and enjoying life will also lead to an adult who's having fun and enjoying his life. If a child is morose, mechanical, then it will only produce a mechanical adult.
Yeah.
And I don't think that parents would want their kids to grow up to become machines and robots. They would want them to be happy, living beings.
But in the growing up, we end up programming them.
Yes, so
knowingly, unknowingly.
I understand that. That's why I'm emphasizing again and again.
Yeah.
That parents should allow the kids to live their life, to enjoy the childhood.
What about special needs children? Children born with autism or any of the special needs. So, what specific signs can parents know of early enough to know that it's a vision that's getting affected?
So one should get the child's eye examination done.
How so?
And as soon as the child is cooperative for an examination of the eye, which is sometimes can be challenging. And at least any gross problems in the eye could be picked up and be treated. Because it's for a special child, it's very, very important to have good vision.
Yeah.
Because if the vision is not good, it can affect the overall personality and the development of the child. Sometimes poor vision itself can adversely affect the mental growth.
True.
So it's important for the child to have a good, clear vision. And that really helps in their overall treatment and rehabilitation. So for that, an eye examination is required at an early stage, as soon as a child can be examined properly. Yes.
But it's complicated because one is that anyways the child is slightly different from what one knows. So समझ में नहीं आता है that which organ is most compromised, right?
Yeah.
So at that time, like eyes, if the child is not able to see as much as so-called normal child is able to see, तब तो concern आता है कि maybe there's something with the vision. But what I was trying to understand was that if the parent knows that the child is born with certain special needs, then could there be specific signs to save the eye?
So I think in this case, the child is not able to express the problem, and also because looking at the behavior of the child, parents cannot also not make a judgment,
because there's so much happening.
Yes. So it's important for them to go for a routine examination of the eye. The other body organs are usually taken care of by the pediatrician.
Yeah.
For the eyes, they should consult an ophthalmologist. And sometimes one examination itself may not be enough to give you all the information.
Okay.
The child may have to be examined at different intervals to reach a proper diagnosis.
Because the growth is very fast at that time, or very slow.
And sometimes we may have to take the patient under general anesthesia to be able to examine the eyes properly.
Even a little child?
Sometimes we may have to, if the situation so demands.